The SANAC Civil Society Forum is calling on government to ensure the comprehensive integration of HIV, TB and STI services into the COVID-19 response. The forum is concerned, they say, that the focus on COVID-19 is threatening to derail the gains the country has made in its HIV, TB and STI response efforts. Well, let's find out more. I'm joined by the forum's chairperson, Steve Letsiki. Steve, hello to you. What exactly is the concern for the forum?
Thank you so much, and good afternoon to the viewers. We are calling for government to really upscale their effort, for a proper integration. We know before COVID, there has been, of course, our health system that has been challenged in many ways, even in the era of upscaling effort and towards NHI. However, one of the biggest issues that we've raised is about how COVID is integrated effectively around the already existing epidemic that we've been dealing with, which is HIV, TB and STI. We know 7.9 million people are living with HIV, and we've got quite a number of high cases around TB. In fact, TB is #1 killer in South Africa. So when we respond to COVID, we should not reverse the gains which South Africa has gotten in responding to HIV and TB.
What is the indication? What are the numbers or data that you're looking at, Steve, that's suggesting that is the case?
You see, one of the biggest concerns is that, a couple of weeks ago, there was a report about many people living with HIV who are not accessing treatment in facilities. People either are given small packages of treatment which doesn't last for long, which then means people need to be moving up and down, and it compromises already the already vulnerable population that we are working with in this case. But it's also about ensuring that while we say chronic medication like ARV is accessible, but many other chronic medications should also be made to be accessible. But similarly, it goes with the issue of contact tracing and testing. We need upscaling effort. When we contact trace for COVID, we must contact trace for TB, because we know the two are speaking to one another as respiratory challenges. But at the same time, we also talk about, not only just beneficiaries of facility or of health services at this stage. It's those who work in the space, which then takes really the interest of the healthcare workers working in the space. Are there sufficient PPEs that are needed? And of course, I know Minister has been talking to various stakeholders around responding to the shortage of some of the PPEs. But we are worried that we should not reverse the game. A proper integrated effort that speaks to HIV, TB and COVID is what we are calling to make sure it's aligned. I'm
sure many people will agree with you, Steve, with the focus on COVID-19. We can't lose sight of what is happening with HIV and TB. You raise a good point that the contact tracing for TB might actually be a very, very good idea to pull that alongside COVID-19. So have you spoken to government? Have they been engaging with you? Are they open to your concerns and what you're suggesting?
No, indeed. The South African National AIDS Council and, of course, have been working with the Department of Health to develop a clear strategy of non-negotiables. But, of course, the minister, if he's open to engage many of other various sectors, we do have a forum with 18 sectors, but predominantly Minister of Health should engage with the people living with HIV in this case. But there's an upcoming interministerial committee of SANAC, which is meeting on the 16th, and we are hoping that they will precisely, as ministers, be clear on the agenda on doing that. But also the upcoming meeting with plenary, which is chaired by the Deputy President on the 25th of July. We're hoping that decisions could be made in ensuring that these are non-negotiable. A clear plan, country plan that speaks to HIV, TB and STI should be in place. What research goes that is ethical, that takes in consideration that we do not just test vaccines around. Everyone is consulted and it's included in decision making, but also proper channels that ensures that we don't only speak from a policy level, we speak practically. When a patient goes to a facility, they're not turned back because there's no ARV, they're not turned back because there's no condom all the necessary strategy that we've put, which only ends in 2022, must still be implemented. If we want to suppress the viral load, we must still invest in the efforts that we've committed. So that means we cannot turn around and reverse those gains as we've called for.
Steve, final question to you. It all comes down to money and how to handle COVID-19, along, of course, with HIV, TB and STI. Are you concerned that the funneling of funds into COVID-19 could be affecting the rollout of the medication for HIV, TB and STI?
Well, of course, we've seen this. This is not only a problem for South Africa. There has been priority shifting in terms of how COVID has resources moving from what countries had planned over the years for this era. But countries never planned for COVID. That means then you shift what resources were packed for other priorities to respond to the pandemic that we see that was prescribed as a disaster by the president of South Africa. But what we are saying is that the resources must be used effectively and must reach the right constituencies. That means if resources are tapped for treatment, that must be bought. Treatment must not be compromised. Resources that must be going to communities to respond on prevention and also in responding to some of the social and structural issues, that means we have to do so. Our community is very diverse. You cannot look at resource from just a club, a blinder segment. You need to look at the intersecting issues that speaks to every population. Are you targeting LGBTI? Are you targeting people with disability? Are you targeting the whole spectrum of people living with HIV and those affected by HIV? But also looking at the people who are affected and infected by COVID at the same time. What are the needs analysis that are put in place so that we do not miss the step to address the social and structural elements of it? Of course, this is putting enough issue on the economy, and that's what is concerning us.
Steve, as always, it's a pleasure speaking to you. Thank you for your insight. SANAC Civil Society Forum Chairperson Steve Letsike joined